Our next speaker, I'd like to introduce Dr. Erin Scott. She is our Global Surgery Research Fellow and General Surgery Resident at University of Massachusetts in Worcester. And she's going to, I think it parlays nicely into Dr. Aliande and Dr. Ribiello's talk in how to approach and set up these initial partnerships and collaborations to be successful and equitable. She'll be addressing striving for equity in global surgery, the role of the needs assessment.
Thank you very much. And again, thank you to Drs. Aliande and Dr. Ribiello for that nice transition right into this talk. I think you'll find some similar themes here. So hello, everyone. I'd like to thank the International College of Surgeons for allowing me the opportunity to speak today on an important topic, which is the role of the needs assessment in equitable global surgery partnerships. So as a bit of background, over the last 10 years, there's been a surge of interest in global surgery, as we all know, with an emphasis on integrating policy for surgical system strengthening into national health strategic plans, focusing on countries with the greatest need for surgical care. However, in very recent years, calls for the decolonization of global health have intensified. Such calls draw on analyses of structural racism and related examinations of global colonialism's impacts, most notably in the Global South, where a large portion of global health and global surgery efforts are now based. These analyses highlight the asymmetries in global health and argue that such inequitable power balances have their roots in colonialism. Here you can see an illustration of colonialism's lasting impacts in global health. This is a map of the density of surgical non-governmental organizations with higher density in the darker blue regions. You can see the NGOs are clearly concentrated in the Global South in areas with strong colonial histories. And on the second map, we see the distribution of surgical NGO headquarters, with the leaderships clearly concentrated in the Global North. These two maps are very similar to what you might see in illustrations of global colonialism not that long ago, and also similar to what you might see in distributions of current global surgery partnerships. So the question is, what do we do to support the shift away from unequal power dynamics in global surgery? I'm from an academic institution in a high-income country. I would say that many attending this conference are also. We have an obligation then to acknowledge the ethical considerations that come with participating in global surgery partnerships, and that starts with both an understanding and an active practice of diversity, equity, and inclusion principles in these collaborations. But marketed statements on a website are not enough. We must practice what we preach in global health, considering the colonial roots of the field. In a recent editorial, Dr. Olusanya, the director of the Nigerian Center for Healthy Start Initiative, really brought it home with this remark. Global health research and policies that violate DEI principles are unlikely to reflect the legitimate aspirations of populations in low and middle income countries. And thus, the focus must be on collaborative, multi-institutional partnerships that seek to uphold these aspirations, which are best defined through a properly implemented needs assessment. But first, what exactly is a needs assessment and what is the intention? I like to remember that it is at heart a process. It's not a singular document, it's not a survey. The assessment is a series of discussions, talks, meetings, in-person visits, all dedicated to each stakeholder in the partnership, learning more about the other. It identifies areas of need so that evidence and data can define a baseline and help drive fruitful conversations moving forward. In general, it should address 6 crucial domains as outlined by the Lancet Commission on Global Surgery: infrastructure, clinical care delivery, workforce training, research capacity, information management, and financing. So why exactly is a needs assessment? Well, needed. You want to be sure that your collaboration is engaging in projects that prioritize local needs, not the advancement of your own interests. The aims of any equitable partnership must focus on addressing local priorities, and that's where the needs assessment comes in. Second, if employed appropriately, the needs assessment will naturally help support collaborations that ensure sustainability and promote equity. In doing so, you can ensure that your collaboration is pursuing projects that serve the local system in the long term by teaching skills, providing education, or improving access to resources, and hopefully all three. Drop-in trips may help offload surgical burden in the short term, but they can perpetuate oppressive relationships. So remember, the ultimate goal is working together towards long-term improved population health and reduced surgical disease burden. As a bit of context for the experience of developing a needs assessment, I'm going to take an aside to introduce an example of how this process works in real time. Here's a brief overview of the structure of an initiative that my team's currently working on in conjunction with the American College of Surgeons Operation Giving Back. Together, we formed a consortium of 12 institutions listed here to work with the University Teaching Hospital and University of Zambia in Lusaka to expand their research and training capacity and surgical care delivery system. And here you can see some of the leaders of our consortium on their most recent site visit in March. So within this consortium, the entire group of faculty, trainees, and nurses involved are split into 4 work groups: clinical care, research, education, and quality improvement. There are representatives from Zambia and the American College of Surgeons within each group. So we're currently undertaking a needs assessment, and this is a brief description of how we implemented the process. We first created a task force with representation from each work group, including reps from Zambia and the American College of Surgeons. And we then tasked each work group to develop a subset of questions that they felt were relevant to their group's aims. The task force compiled the list into one survey and undertook a process of iterative review to ensure that all questions were relevant, appropriate, and necessary. This involved multiple rounds of review and revision with our Zambian colleagues. In terms of distribution, the Zambian faculty and trainees led the charge and disseminated amongst their colleagues with interval reminders and promotion. Finally, with some delays due to the pandemic, which I'm sure we're all tired of hearing by now, we've been able to continue the needs assessment process with in-person site visits from each work group, starting most recently this spring. So with that example in mind with Zambia and the American College of Surgeons, I think several key steps stand out as points to drive home here. How do we implement a needs assessment that promotes equity? First, all collaborative partners should use the assessment together to amplify marginalized voices. During this process, we should identify, involve, and defer to the expertise of local champions. This is critical for advocacy, local engagement, and buy-in throughout the entire partnership. This is why the distribution of our needs assessment was successful in gathering responses, in my opinion. Zambian faculty and trainees led the distribution process among their own colleagues. I will highlight that in many cases, especially in environments with strict hierarchy, trainee voices can be considered marginalized. I think that emphasizing their involvement and their responses in this process was crucial to defining actionable areas. We must also create space for our partners to establish agency and participate on their terms. If something isn't working for them, listen. Secondly, every needs assessment should absolutely include an appraisal of needs on how to best support LMIC partners to become leaders in their fields. In many cases, this is identifying ways to increase research autonomy and facilitate dissemination of local work with local authorship. In our case with Zambia, we're working to create research dyads and triads that focus on research capacity and infrastructure in order to supply statistical support, mentorship, access to international journals, and whatever else they may need in order to propel the work of our Lusaka colleagues. Third, the needs assessment is a fluid process. It is not a document. Flexibility is paramount to being a collaborative partner. Recognize when something isn't working and also be open to redirection. There was a point in our dissemination of the needs assessment where the group determined that anonymity was a crucial determinant in gathering honest responses. So we removed all identifiers and started over. With that in mind, continued awareness is key. Cultural and political factors in global collaborations may require different approaches than what has worked in the past or in other places. This also pertains to having the humility to recognize that the resources you may be able to provide are actually wanted and useful. What good is donating a robot system, for instance, if the local culture has no interest in adopting it, or maybe the maintenance and infrastructure to keep it going? Lastly, a reminder that in implementing a needs assessment in an equitable global surgery collaboration, we must actively address bidirectionality at every step. I think this is also a nod back to humility. We all can learn from each other, which is one of the remarkable things about truly global partnerships. So finally, some closing thoughts. There are unique challenges in global surgery owing to the multitude of actors and interests at play. Therefore, it is up to active participants to lead by example and honor the commitments to advancing health equity and achieving universal access to surgical care. And so one way is through the thoughtful implementation of a needs assessment. Thank you.
Thank you for that. We have a question from the audience.
Thank you, Dr. Scott. I had the privilege or the things of working in third world countries. My question is sustainable quality versus technology, and that's really a problem in these third world countries. Some equipments were not working. I went to countries where they had equipments, but you couldn't use them because they were, of other reasons. So my question is, how can we do sustainable quality versus technology? Because when we come in, from the U.S., we think about technology. We have, and I work in a rural hospital where I don't have the robot. So I'm aware of this. Even in the U.S., there are disparities. So the question is to make a sustainable quality versus technology. Thank you.
Sure. So I think that this goes to two main points. One would be, again, like we were talking earlier, to try to find local resources. Two would be for us to put pressure on our colleagues in other high-income countries to not just donate equipment, but also donate equipment that is sustainable in those countries, where we can train people to maintain the equipment in the long term, rather than, as Dr. Rubidello and Dr. Alianda had mentioned, just dumping waste disposal. And so I think if we can put pressure on companies to also invest in the long term in sustainable technology, that would probably help.
I know that you did a tremendous amount of work on both, formulating and distributing the needs assessment. What did you find, was the biggest obstacle in the initial distribution? And going forward, do you foresee changes to the needs assessment process in Zambia?
Sure. I think it's very easy, especially in this virtual climate where it's difficult to get everyone on the same page and in the same meetings quite frequently to really make these things push through. It's easy to just say, right, I'm going to do this myself and just distribute this survey, and it's just going to be faster this way. But I think that taking the time to ensure that there was representation across the board and at every point in the process was very important. And it maybe took a little bit longer than some people would have liked to push it through. But I think the important thing for me was making sure that we had Zambian colleagues reviewing every step of it. We had trainees reviewing every step of it was incredibly important. And so I think one of the challenges oftentimes is trying to push things through and to get it done and mark it off, but taking the time to ensure representation is really one of the keys, I think, for these partnerships.
Thank you so much.